My name is Mr Simon Heppell. I'm a consultant plastic surgeon working principally out of Adnova Clinic near Fareham, near Portsmouth. I very fortunately realised that I wanted to be a doctor when I was about 9. And I then wrote to the army when I was 13 and said I'd like to be a doctor in the army. And when I went through my exams and then got to medical school, I realised that actually I had made the right decision and I was very happy doing it. And that evolved from going to medical school and becoming a doctor to becoming a surgeon, and from there becoming a plastic surgeon. And I qualified as a consultant in 2007. I evolved to the specialty of plastic surgery through test and adjust. I was the fortunate opportunity to see a number of different specialties through my training, and had the opportunity to work as a surgeon in these various specialties before finalizing on my career path of plastic surgery, which I have been doing since 1996, and very happy to have made that choice. Plastic surgery isn't often described as life-saving, but it is absolutely quality of life-saving. And I certainly get an awful lot of personal reward and satisfaction out of my patients' outcome post-surgery, their improvement in confidence and their perception of appearance. And this leads to an increase of quality of life. And the vast majority of my patients are able to express improvements across the board in feeling, their appearance, their confidence, and this in itself is hugely satisfactory. I think honesty and integrity are vital in the relationship between a surgeon and a patient. As a surgeon, I don't think I can offer anything to a patient who doesn't fully understand what it is that he or she wants, so that they can then express that to me. The way I describe this to patients is that you must be honest with yourself before you can be honest with me. And I think it's absolutely crucial that patients have an understanding of what it is that they want to achieve, a recognition of perhaps what it is they want to change. And sometimes that takes more than one consultation to do so. And I think it's really important that patients recognize, and I always see patients at least twice before surgery, that there is thought and then decision. And sometimes we can make that decision fairly quickly and others we can't. And if we can't make that decision quickly, we should be taking the time that's necessary to do so, so that by the time we get to an operation, we're absolutely in the right place, doing the right procedure and doing it once. Catchphrase. I think there are different things that suit different circumstances. There are a group of patients that I operate on that I get huge reward from are patients after massive weight loss surgery. And I think there's very much, I talk to patients about doing as much as I should rather than as much as I could. I think it's important to recognize that when we're limiting harm or limiting damage, and part of that is reconstruction, when skin has been overstretched, overtaut, that if we make things too tight again, not only do we increase the risk of complications, but potentially we're stretching the skin yet further. So it is not in anyone's interest to do that. And so I go back to as much as I should, not as much as I could.